Good morning, and I will try not to delay the lunch. I am sure you are quite hungry, and I saw outside that it seems okay. Okay, and we will speak a little about the optic assessment in fetuses. The initial problem is the counsel of families that have a child with an isolated septal agenesis that it has becoming more and more common since we are performing ultrasound and looking at the septum pellucidum. There are cases you see that the septum pellucidum is not present, and the question always is this isolated or is something is part of the septoptic dysplasia? If you read the previous book of Barkovich on pediatric neuroradiology, he wrote there that there is not such a thing as isolated septal agenesis. If you find a patient with septal agenesis, it's always associated with or visual or hypophyseal problems. In the last book, he changed because we start diagnosing cases in utero, and there should be between us, let's say between 5 and 10 persons that have septal agenesis and don't know. So more or less at the same time, okay, it will not work. I don't know exactly why, but more or less at the same time, error. I am sorry. More or less at the same time, we start looking fetus and we see that something is moving beyond the eye, inside the retrobulbar fat. And this is this black line that moves from one side to the other. And you were obstetrician, so the first time we saw something moving there, I called our pediatric ophthalmologist and say, tell me, the optic nerve moves? And he said, sure it moves. It moves inside the fat. So we are looking there at the optic nerve. And we went to the literature, as always. A lot of first papers were published in the literature regarding obstetric ultrasound by Birnholz, and he describes in 85 the optic nerve sheet. He also described, by the way, in ultrasound 85 the optic chiasma and also the posterior obstetric tract. But there are not normal values available regarding the size. Lastly, the group from Bolt was able to depict using 3D techniques the chiasma and to measure the posterior and anterior tracts. This represents to us, when you look for something for a long period of time, you can see this image, but if you look differently, you will see this image. This is what happened. The structure is there, and you can visualize, as we showed today in the previous lectures, that there are a lot of structures that can be visualized, but we are not aware of them, or we are not willing to visualize them because they seem to us not important. When we spoke about the optic nerve, actually it's not a nerve, it's a false nerve. Actually, the optic nerve is white matter. It's a white matter tract that goes out from the CNS. It is derived from the outpouching of the encephalon. The fibers are covered by myelin instead of being covered by Schwann cells. And the optic nerve is sheeted by meninges. So actually, it's the only portion of the brain that is outside the brain. We can perform sonography of the optic nerve in children and adults, and actually what you see here again is the optic nerve sheet that is formed by three different different structures. Okay, the optic nerve sheet itself, the fluid around, and the optic nerve. Now, if you look from the outside to the inside, we can check the intracranial for intracranial hypertension by an enlargement in the optic nerve sheet. In this case, the optic nerve should be normal, and the perioptic subarachnoid space should be dilated. This is useful in children, and we have probably that also in fetuses in cases of hydrocephalus, intracranial tumor, or pseudotumor cerebri. In fetus, it's quite different. It's quite difficult to be sure about that there is an increase in intracranial pressure, because you know that the fontanelles and the sutures don't let the intracranial pressures go very high. If we have optic nerve hypoplasia, we'll have a thin optic nerve with a normal subarachnoid space. In children, we know that the optic nerve sheet should be around 2 millimeters. And there were non-described methods to measure it during pregnancy. Also, when we look at the eye, you need to remember that you can find other pathologies as microphthalmia, retinal detachment, or colobomas. We performed this study to try to understand better how the optic nerve sheets develop in different pathological conditions, to improve our diagnostic accuracy, and to help counseling patients in these cases. Those are the measurements in children. You see here around 2 millimeters with a standard deviation. And how in the fetus? In the fetus, when you look at the eye, first of all, you have the eyelid, the anterior chamber, the lens, the posterior chamber. In the posterior, here you have the retrobulbar fat that is usually triangular, and it changes in echogenicity through pregnancy. It starts being very, very hypoechogenic, and in the third trimester is completely echogenic white. And inside you can see the optic nerve and the optic disc papilla. Now, how we measure the optic nerve? We make a distance of 2 millimeters from the orbit, and we measure the maximal diameter in this perpendicular plane. Okay, here you can see the optic nerve in another case. It's quite easy to observe it after 20 weeks. Our research line was, first of all, to describe the technique of optic nerve sheet visualization, to establish normal values and cutoffs of the open neural sheet diameter through gestation, and to correlate our findings with pathological cases. We published this paper at the end of 2011, and the paper was, the senior author was Nina Haratz, that worked in our unit as a fellow. Here are the measurements. You can do it by 2D and also by 3D, and it's quite simple. And we look for the normals between 22 and 25 weeks, and again between 34 and 36. Why? Because we had the pathological cases, and we want to have normals, so we did it very fastly. We didn't complete the study yet regarding the whole pregnancy. We would like to continue by measuring the anterior-posterior diameter of the vitreous to improve our diagnostic capabilities in cases of microphthalmia. And at the same time, we are looking at the behavior of the retrobulbar fat, how it changes through pregnancy. And this is important because also for other conditions, as pericallosal lipomas, I will show you today cases, or in cases of closed pinna bifida, that always the question, is there a lipoma or not a lipoma? And you can be sure that there is a pathological closed neural tube, but we'll never be able to know for sure that there is lipoma or not until the third trimester, or will be difficult at this. We have case one, it's a 32 years patient that we saw them at 24 weeks and 5 days. It was referred because of posterior fossa malformation, suspected of Dandy Walker, but actually it resulted to be a thrombosis of the torcula. You know that thrombosis of the torcula seems, when you make diagnosis, a very bad condition, but usually the prognosis is very good. What we did was to measure, in this case, because of the supposed increased intracranial pressure, the diameter at 24 weeks. The normal is around 1.2 millimeters, and it was 2.1, probably speaking about an increased intracranial pressure. In this case, the pregnancy continued, and after 3 weeks, the thrombus start to go down in size, and also the size of the optic nerve sheet start to go down in size. The second case was a patient referred because of hydrocephalus with a suspected intracranial hemorrhage, but actually it turned to be a tumor, a huge tumor of the brain. And here we measure at the optic nerve sheet was 3.3, very, very, very dilated. The normal should be around 2.7. The fetus was delivered in Chile and underwent ventriculoperitoneal shunting, but died later on. And the 26th of February, one day before we leave for Berlin, we have this patient, again, with an intracranial tumor, a huge intracranial tumor, and we perform also the measurement of the optic nerve sheet, and you see that this increased intracranial pressure, the optic nerve sheet is quite dilated. Fetal optic sonography assessment is feasible, at least, and provides high-resolution images of the fetal eye and retrovulvar structures. Optic sonography may add important features in the decision-making process in fetal pathologies. Normograms of the optic nerve sheet are being constructed and will be available for consultation shortly, I hope. And this is an extensive field of research because there is a lack of available information in the medical literature. Thank you very much, and almost in time. Bon appetit.